Let's shake things up.
Oh, I don't like the sound of that one bit.
Don't worry, you're in the hands of your personal brainologist. For today, I want to talk about something that's very serious, actually, the syndrome of epilepsy or seizures. Seizures are abnormal electrical discharges that can come from anywhere in the brain, the cortex, deeper underneath, etc. The way that seizures are measured are with a non-invasive test. It's called an EEG or electroencephalogram. It's basically a little cap that is put over the head and wires come out of different parts of the head. Here's another view looking from the top of the scalp, and this measures brainwave activity in the head. And so, for instance, normal brainwave activity would look like this across all of the electrodes. Abnormal can look like this, squiggly lines, right? Aberrations in electrical impulses, really squiggly lines over here in different types of seizures. I'm not going to get into each of them, but you can see how abnormal these various EEG examples are. And neurologists read these to determine if somebody is having epilepsy or a seizure. One of the really fascinating areas, and here's a brain break, of the brain where epilepsy can emanate from is what's called the temporal lobe. Temporal lobe is this area here of the cortex, and temporal lobe epilepsy emanates from this area. It's very busy. There's a lot of different structures that occupy that space. As you can see, the hippocampus, the amygdala, some fight-flight structures. It can produce not just motor symptoms, but also a variety of other sensations like memory abnormalities, like déjà vu, for instance, or even hallucinations, different fight-flight responses like increased heart rate, things like that. When the EEG is negative and you still have somebody presenting with a seizure-like presentation, that is called psychogenic non-epileptic seizures or functional seizures. It's a behavioral neuropsychiatric disorder that looks like epilepsy. So you have some epilepsy syndromes that look like psychiatric phenomena. You have some psychiatric phenomena that look like epilepsy. This is why for centuries we've actually been confusing the two very often and treating epilepsy in psych spaces and treating psych in epilepsy spaces. I've actually presented on this topic, and it's a rich discussion about the different ways in which epilepsy and psychiatry interact. As you can see, epilepsy can present with acute neuropsychiatric symptoms. Epilepsy has its own psychiatric comorbidities, meaning other conditions like depression, anxiety, psychosis. Psychiatric illness can have effects on epilepsy itself. Psychiatric treatment can affect epilepsy. And then, of course, there's central nervous system conditions that influence both brain and mind. It's a very rich topic. I'm Dr. X, your personal brainologist, and if you're interested in learning more about epilepsy, psychiatry, or other topics like chronic pain, addiction, ethics, please follow me.